college-based Red Cross youth organization inside Our Lady of Fatima University, Valenzuela City campus, under the jurisdiction of Valenzuela City chapter of the Philippine Red Cross. The name of our initiative is Purple Hero Project, with the theme I Will Fight. It focuses on giving services to individuals and their family members who suffer from epilepsy and seizure. In the Philippines, epilepsy and seizure are overlooked because they are very selective phenomenon. Therefore, individuals suffering from this condition are usually discriminated. Keeping that in mind, we plan on educating the community about epilepsy and the importance of mental health. We hope to create a platform for their voices to be heard and embraced in the community. With the ongoing pandemic situation, we intend to keep such individuals safe from being exposed to the virus as a result of frequent hospital visits. Thus, we aim to establish a platform where they can obtain all necessary help or services from the comfort of their own homes.
Epilepsy is one of the most common neurological diseases globally, yet it is highly stigmatized. To test this, we conducted a survey where the questions were based on general medical and social aspects of epilepsy and seizure first aid. We were surprised to see the results and soon realized that we need to create a prototype that not only caters to people with epilepsy and their families, but also a tool to educate the society. Hence, we decided to design an app. The app has many features to make the lives of people with epilepsy and seizures easier, such as a seizure journal where they can enter a detailed report on their seizure, a medication manager that reminds them to take their medication timely, a seizure guide that contains information on various types of seizures and their possible triggers is also being provided to them. The user can share this information with their doctors and family members using the Insight Sharing service. Direct dialing to emergency services such as ambulance, psychological support, and blood bank numbers have also been provided. The app offers them a community of people where they can interact and learn from each other's experiences while sharing their own. The app has a newsfeed section where we put up articles and reports related to epilepsy and seizure. This section raises awareness and busts myths on the condition. We share our app's prototype with epilepsy patients and their family members to get their feedback and come up with changes to make the most viable and practical app for them. Currently, our team has developed a full-fledged website based on the app prototype to test out the functionality of our idea. The website is live on Google and we currently have over 100 members. We put up weekly blogs on the website that are fun to read and educational at the same time. We are partnering up with local government units like our city's health office and city's social welfare department. We are preparing to sign a memorandum of agreement with our city's jurisdiction and especially those hospitals that have advanced neurology departments. With the help of our city's health office, we are trying to get into a partnership with Philippine Neurological Association and Child Neurology Society of Philippines.
Our biggest learning from the initial prototype was that we had to make the website bilingual. Because we need to disseminate and educate people at the local level, we had to account that not everyone speaks English, and so we provided it in Tagalog as well. Few changes were suggested, such as writing blogs in Tagalog rather than just English, along with the inclusion of search bars in the emergency contact section for easy access. We also worked hard on the website security and privacy policies to protect our members' information and establish a safe and secure community. Overall, our website was favorably welcomed by all. Following the website's testing, we received a variety of feedback regarding its beneficial impact on people's lives, such as the ability to obtain blood from a blood bank on an urgent basis throughout the Philippines. Ambulance services were provided immediately to their location, as well as 24-hour psychological support and COVID updating services. Yoga and fitness sessions provided have assisted many people in maintaining their mental and physical health. Our website also aided many individuals and families dealing with this issue in keeping track of their seizures and determining the major triggers and frequency of the same. Because persons with this condition do not remember anything during or after an epileptic attack, these records can be converted into a report and shared with the doctor during consultation.
If our team receives additional initial funding, we plan to broaden the scope of our initiative. We plan to utilize the funds to convert the website we created into a full-fledged mobile app that could be used on both Android and iOS devices. We would create a section where the patients could make an on-call or virtual appointment with his or her doctor. Users will be offered a one-touch call service to nearby hospital and other emergency services based on their geographic location. There would be a fitness tracker to monitor their overall health as well as sleep tracker to ensure they receive enough rest. There would be insights to help people track their monthly and weekly progress as well as seizure trends and circumstances that may have precipitated that specific seizure. We would also use the additional seed cash to broaden our survey and distribution to a much larger community.